Today, we are going to be talking about one of the most important superbugs out there, and that is MRSA, methicillin-resistant staphylococcus aureus. Up to 80,000 people catch this bug every single year in the United States, and it accounts for more than 10,000 deaths annually. You've probably heard the name, but what is it? How does it spread? What do you need to watch out for? What are the symptoms? And most importantly, how do you prevent it? And how do you treat it? Let's take a closer look. So MRSA is a bacterial infection, and that is really important to understand. It's not a virus. It's not a protozoan. It is bacterial. And in microbiology, we say that it is a gram-positive cocci. In other words, the cell wall structure, it's got a very thick cell wall. It is circular in its shape, and then when you do this process called the gram stain, it looks purple under a microscope. This microbe often lives in the nose and in the throat and on the skin of people, and it can be there as part of the normal microbiota, and a lot of people will have this microbe on the surface of their body and never even know it. So how does it become a problem? It becomes a problem when it winds up infecting a wound, or even more importantly, when it gets into the bloodstream or potentially causes a respiratory infection. There's a couple different ways that you can catch MRSA or contract MRSA. One is in a hospital, so the hospital-acquired infections, where when you go to a doctor's office, maybe it's through surgery or catheters. Often there are people with weakened immune systems, and so MRSA can spread a little bit more easily. And then there's the community-associated MRSA, and this is when you're contracting it just out in the general public, and otherwise healthy-looking people might have the MRSA organism on the surface of their body, and you can contract that through physical touch. This is especially true when you're dealing with athletes or any type of physical contact. It can also spread through things like using towels, sharing razor blades for shaving, and contaminated surfaces. So let's talk a little bit about the pathology. What does it actually do when it's inside the body? Well, the first thing that a lot of people notice, especially if it's associated with a wound infection, is a red, swollen, painful skin bump or a boil. Sometimes there will be pus or drainage from the site of the infection. A lot of times there will be warmth and tenderness around the infected area as well. If that particular area is infected and it's following up with fever and chills, that could mean that the MRSA organism is now systemic. It's in the blood, and that can be a much more serious issue. Additional severe cases might lead to pneumonia or joint and bone infections, and in those cases, when the microbe is systemic, immediate medical attention is necessary. And I want to state here right now that if you suspect that there is a wound infection or an infection of any kind, seek medical attention immediately. So there are lots of different types of Staphylococcus organisms and even different types of Staph aureus. The one that is most concerning is, of course, MRSA, that is methicillin-resistant Staphylococcus aureus. Methicillin is a type of antibiotic. And these microbes may have a couple of special genes, one called MRSA, and that is it provides a special protein that can help make antibiotics, well, mostly useless. Some community strains will also carry a toxin called PVL, and that destroys white blood cells, and that can also cause tissue damage. Thankfully, MRSA can be prevented, and there's some pretty easy precautions that can be taken. In hospitals, that means really good aseptic technique, making sure that any instrumentation that's coming into contact with patients has been sterilized where possible or heavily disinfected. It means using proper PPE, personal protective equipment, gloves and gowns, making sure that surfaces are disinfected, that equipment is properly sterilized and clean, as I've already mentioned. In the community, it means being aware of your own hygiene, washing your hands, showering after sports and physical contact, not sharing towels and razor blades, and just keeping cuts clean when they happen and bandaged. Another important aspect of prevention is only using antibiotics when necessary, and only using antibiotics for bacterial infection, and using the right antibiotics to slow the spread of antibiotic resistance, which is such a problem with MRSA. Now, treatment with MRSA It can be treated. It gets a little bit more tricky because, again, these organisms are methicillin resistant, which means that one of the primary antibiotics that's used to treat bacterial infection is not going to work. The microbes are resistant to that particular antibiotic. So treatment for small skin abscesses means sometimes draining the wound, done by a professional. For mild infection, the doctor might prescribe oral antibiotics. Clindamycin is a really important one. The trimethoprim combined with the sulfa drugs might be another option. For more serious infections, often that requires IV antibiotics like vancomycin or daptomycin. The key here is tailoring the treatment based on the severity of disease and using the right antibiotics for the infection. So yes, MRSA can be a very serious infection that usually requires immediate medical attention to determine what the severity is. The longer you let it go, potentially the more severe it can be. Keep your cuts clean. Make sure that you're using proper hygiene. Make sure that you're disinfecting areas. Shower after sports. All of those things are really important to help prevent it. But seek medical professional if you feel that you have a wound infection that is not healing over time or is getting worse. As always, thank you so much for being here. Have a great week, everyone.